Message from Gladys every day is the same. The only way out of continuous lockdowns are high vaccination rates. However, I feel the reality of the full easing of restrictions to a prior normal will not be the case. With potentially a large number of the population that won't get or be vaccinated, how can we possibly ease restrictions when society still run the risk of spreading the infection in the community?
Now, I should point out too, we've received a number of questions from people frustrated at cases leaking out of Sydney into the regions. We've particularly seen that this week in Byron Bay, Tamworth, Armidale, Walgett, Dubbo. Canberra's now in lockdown as well, as we can see tonight. We're yet to see that being linked, though, to the Sydney outbreak. Angela, we don't know what sort of restrictions Gladys Berejiklian might ease. She's saying she'll have more options if there are 6 million jabs delivered. Should any restrictions be eased at that point?
Look, I'm not an epidemiologist, so I'm not going to go to what the restrictions necessarily should be. What I can say, I think, for the people of Sydney, and I think Luke's question goes to this, is that the uncertainty that they're living with at the moment is pretty much unbearable. As human beings, I know as an economist, we deal with risk quite well, but with this uncertainty is really, really difficult. And I think, as you know, as someone who lived through Victoria lockdown last year, when that announcement came at the beginning of September from Premier Andrews that what the roadmap looked like, what the targets were, there might have initially been a bit of swearing at the television, a little bit of upset, a bit of depression. It wasn't a great day. But what that gave us was a clear roadmap out. It gave us certainty about what we were heading for. And I really think now, for me, that's what Sydney needs. It needs to know, well, what are the vaccination targets? What do the case numbers have to be at each level of vaccination for them to come out safely? They should have that modelling, and I think it is time to share it because, I mean, you know this, people in Sydney, they're suffering. They're suffering under this uncertainty of, every day these cases go up. It's not clear where they're actually heading. So more clarity on that. I think they need certainty and they need a plan.
Yeah, Paul, Zahra, I mean, would you like to see any easing of restrictions before the 70 and 80% vaccination thresholds agreed by National Cabinet are met?
Look, I think there can only be one umpire here, and that's the health professionals, and we've been following their advice, to be really frank. We were very much against lockdowns as an industry last year, but that was different to what we're seeing today with the Delta strain. It's a very different proposition, of course. So it's highly infectious, and the only ticket out to freedom is vaccinations. And the biggest issue really is around inventory and getting access to vaccinations right now. So it's the only silver bullet we've got.
So, Catherine King, if the New South Wales Premier did receive health advice that it's okay to ease some restrictions in parts of Sydney once they're at 6 million jabs and allow some greater freedom, do you think she should do it or wait until that agreed 70 and 80%?
Well, I think that, the first thing to say is, we feel awful for the people in Sydney. ACT's just gone into lockdown. Melbourne's still in lockdown today, and regional Vic, my hometown, has come out. But there's a lot of, anxiety about, is that going to last? And I think the reality is we all need Sydney to get through this, and we've all got to make sure that we're singing from the same song sheet. I think it is important that there's a national plan. There's a plan that's been agreed around the level of vaccination for restrictions to start easing, and I think the Premier of New South Wales needs to listen to the health experts, but she also, for the rest of the country, needs to make sure that she sticks to that plan that's been agreed. The fact that we are here, though, is so frustrating for, particularly, those of us from Victoria who have been through this. We spent a long time in lockdown last year, contributed nationally to keeping everybody safe by the decisions that Premier Daniel Andrews took and all of the sacrifices we made, and it just feels as though it's been squandered because of this debacle of a vaccine rollout where we've only got 19% of the population fully vaccinated, and we're having this Hunger Games between priority populations versus states about how we manage all of this because, frankly, the Morrison-Joyce government just did not do its job.
Alan Kohler, this decision that Gladys Berejiklian is presumably going to make in the coming weeks is going to be a critical one in this pandemic. The other states all have a stake in this as well. How do you think they're going to feel if New South Wales does start to ease restrictions too soon? And what about the Prime Minister? Does he need to stand up with more national leadership on what should be done here?
Well, we've learnt for a start that the Prime Minister doesn't run the show anymore. It's the states who do it. Part of the reason this has been an epic stuff-up is not just the vaccine rollout, but there's different standards of lockdowns across the country. All the premiers are doing different things. So, yeah, I mean, obviously it'd be terrible if Gladys Berejiklian opened up New South Wales too early. The other thing to say is that this so-called plan is not really a plan. It's a sort of a guess by the National Cabinet as what might happen, because the lockdowns are called in response to actual cases, not according to a percentage of vaccination. So they're saying they think that when they get to 70 or 80% vaccination, then might be able to ease lockdowns, but they don't know. I mean, and also the 70 or 80% is of the adult population. That's 54% and 63% of the total population. So there's a lot of confusion about when we're talking about percentages, what are we talking about? Is it the adult population or is it total population? Nobody kind of knows.
Well, the agreement's on the adult population, is it? The over 16, as you say.
That is true.
That's a lot lower if you include kids.
But when Gladys Berejiklian says 50% of the population in New South Wales, is she talking about the total or the adult?
Well, it's interesting, isn't it? Because she's talked about 6 million jabs, which isn't even necessarily 50% of the population. It's less than that if it's 6 million jabs. Catherine King, I can see you expressing some concern there. Do you think that is still not cautious enough?
I think given the case numbers that we're seeing in New South Wales, then I don't think it is cautious enough. I think it is absolutely sensible to be trying to get as many people vaccinated as possible. And we saw, obviously, in Victoria, we see when there's lockdown, the demand for vaccines goes up again, and we clearly cannot keep up with that demand with the supply that we've got currently. Let's hope we get our way out of it. But it is absolutely clear, I think, that is the lockdown that is going to be the thing that really gets New South Wales out of this. And I think there's lots of examples in other states as to what's worked. It's in all of our interests that we help New South Wales as much as possible, because we do not want to see continued lockdowns, continued stress and being put on people right the way across the country. And we really want them to get out of this, and whatever help New South Wales needs, then we should be giving them.